Top 10 interesting facts about the newborn that you never suspected. You have already successfully gone through pregnancy and childbirth and you think that you know everything you need to know about your newborn baby. But here it can always surprise you. First fact: soft areas above and behind the head, called fontanelles. When your baby is born, you will notice two soft areas on the top of his head and on the back of his neck, where the skull bones have not yet joined together. This is nature's way of making the baby's head a little narrower, so that it can pass more easily through the birth canal. The second fact: the posterior fontanelle, which is triangular, closes about 8 weeks after birth. The other is larger, diamond-shaped, and takes some time to close completely when your baby is between a year and 18 months old. Second fact: poop. You have probably read or been told about the baby's first bowel movement, meconium. Meconium looks like tar and is difficult to excrete, but it only lasts a few days. Once the meconium stage is over, the baby's poop will change from greenish brown to grainy yellow or brown in 3 or 4 days. Third, improper breathing and noise during sleep. Sleeping like a baby is actually an absolute myth. Babies are known to be very noisy during sleep. In fact, a newborn's normal breathing rate is about 40 breaths per minute while awake, and this can be halved while sleeping. They can even speed up the pace by taking shallow, quick breaths for 15 to 20 seconds, followed by a complete pause in which they stop breathing completely. Of course, this can upset even the calmest parent, but this is perfectly normal. Four, cross eyes. Newborn babies often roll their eyes after birth. Their eyes struggle to work in unison in the beginning, just like waving and uncoordinated arms and legs. You have nothing to worry about because this will pass by the 3rd month. By 4 months, babies should be able to track objects with both eyes thanks to better eye-hand coordination and depth perception. Five, vaginal bleeding or discharge in newborn girls. The effect of maternal hormones in the lump before birth can cause an unexpected phenomenon in newborn girls, vaginal bleeding or the presence of a cloudy white discharge. Seeing one can be very alarming, but don't worry, it's perfectly normal. No special care is needed. Just clean your baby's genitals as usual after changing the diaper. Six, swollen breast tissue. It's normal for baby girls and boys to have slightly swollen breasts or breast tissue after birth. Again, a strange effect of the mother's hormones in the lump. You may even notice how little milk is released. Don't worry, the swelling will decrease in the first few weeks and months. 7. Blue or cold hands and legs. Newborns' arms and legs may look blue or feel cold to the touch. This is due to immature blood circulation and does not necessarily mean that the baby is cold or that you need to increase the heating. As long as the baby's lips and tongue are pink, you have nothing to worry about. Try rubbing your hands or feet to keep them warm, putting on socks or even just cuddling the baby a little. Eight. Pimples on the baby's face. You may notice small white pimples on your newborn's baby face. These pimples are known as pimples and are caused by your baby's developing sweat glands. They are completely harmless and will disappear in the first few weeks. Nine. Exfoliating skin. At birth, your baby's skin is covered with a coating called vernix. When it falls off and the skin dries out, you may notice that the baby's skin begins to flake or even crack, especially around the ankles or wrists. This is perfectly normal and it's not a sign of dry skin, so do not apply too much oil or lotion to your baby's skin. Flaking will stop in the first few weeks. And the last 10th fact. Chest cavity. The chest is made up of 3 parts and the baby's immature muscles simply emphasize how they are all brought together. In the middle of the baby's chest you can see a dent. This is just part of the chest at an angle. As your baby grows and his muscles begin to mature, this part will adjust and the dent will disappear. You will probably notice that the dents disappear even earlier, especially if your baby is fluffy and his baby fat actually covers the chest.